So, Janet, tell them about the history of our podcast.
Wow. How long has it been? Is it
October 2019.
Well, we started this because as a podcast because we just felt like there were solutions or information that would be very accessible to consumers that we had access to being on the healthcare professional side that the lay public, even providers, just how do I find it? How do I reach it? And also given alternatives. And the motive we have is that we want our people to be empowered to make their own choices and their own decisions. Because without that liberty, you just kind of pass through a system without any control, and that's not a good feeling. And I don't really believe that all the outcomes that we would expect for healthcare is there. So if consumers are back in the driver's seat and are making informed decisions, then we feel that we've done you a good service, because sometimes we just depend on a professional to tell us what to do without even doing any groundwork. And I will tell you that the patients that have done groundwork and have access to information usually feel better about their outcomes.
Well, I think one of the problems is that most people, unfortunately, they listen to their healthcare insurance,
Right.
and their healthcare insurance company, they have networks and they tell them what doctor they can go to. Well, that's not necessarily the best doctor. That's just a doctor that signed a contract with that insurance company. So unfortunately, patients don't do a lot of their own research. And some of the best doctors don't, most of the best doctors don't take insurance, period. Because I believe if they did, they don't have to take insurance if they are a good doctor, because they will get patients that way. And I will tell you, as a healthcare professional, not having insurance contracts, it is very liberating. Janet did mention
Oh,
that.
yeah.
One of the nice things about it is that people come to us not because their insurance company told them, but because they chose us. Maybe a doctor sent them to us, or they chose us because they found us. And it's based on price, it's based on quality, and it's based on service. That is very rewarding. I will tell you, in a typical healthcare practice, most doctors, physical therapists, pharmacists that bill insurance, the only reason those patients are coming to them is because they're on the preferred network provider list. And that's not very, doesn't make you feel very valuable as a healthcare professional. Right, Janet?
Oh, I agree. And I think one of the things that has been lost in the shuffle is most doctors have taken a Hippocratic oath. And I've heard Dr. Keith Smith talk about this. He's a director at the Oklahoma Surgical Center. And if you are bankrupting your patients, that oath has not been withheld or has not been honored. And it's a crime, because if we look at statistics, the patients that are actually going bankrupt are not the ones that we would think. We think it's all the people that don't have coverage, but it's also patients who do have insurance. So there's something wrong with the system, and it's real, and it has to be fixed. And I think the way we take back is become informed as a public, and also to have providers offer those services to the public at a market price.